Preventive health is actually about tackling the intangible. You do not realize what's happening inside your body until it manifests as what we call a symptom.
Here, the mindset is, I am doing well now. Why should I go to a doctor? Why should I get a screening done?
Some people who say, I'm fit, I go to the gym every day. You are working your heart much more than the average person. Even if you think you're extremely fit, you may or may not be healthy, and they are very different things. And this is a wake-up call for those in their 20s and their 30s, because they actually
Dr. Sathya Sriram, CEO of Preventive Healthcare at Apollo Hospitals. I'm so glad that India is talking about preventive healthcare at a larger scale.
go get a screening, because that's what will tell you what are the top 2 or 3 problems for you to tackle first.
You talked about the decade-specific screening, right? So let's start from 10 to 20.
So the first part, like I said, the second piece is around and make sure a doctor is evaluating the report. That is very important.
Every man should make sure their mom, their wife, their daughter, their sisters should definitely get a mammogram. I've seen so many of my friends where they are diagnosed with stage 1.
Much easier
To
to treat. Problem with not doing it and catching it later in your late 50s, 60s. At that point, we need more and more people to make their health a priority much earlier, so that they are not ending up in the ICU.
Hello guys, welcome to another episode of our podcast, Gut Feeling with Dr. Pal. I absolutely believe prevention is better than cure. We had a wonderful conversation. We had decade-specific preventive strategies in terms of how men and women can be more proactive in their health so that they prevent the disease and focus on prevention rather than on the treatment. And she's also an architect of the Apollo ProHealth program, which we talked about as well. I'm sure you will learn a lot from this episode. Hello, Dr. Sathya. How are you?
Very well. Thank you for having me on the show.
Super. Thank you. I'm actually, I'm very, very excited about the session because this is what I preach in my channel. This session is about how we can take preventive health to the patients so that we can nip the disease right at the budding stage rather than focusing on the treatment. So I'm not sure whether you followed my whole channel, but my mantra is, I always say that at least in the US, the medical system is rigged. Let me explain that. I see patients starting from 8 a.m. and all the way up to 5 p.m., 6 p.m., correct? And in the time that is given to me, I always focus on what is the problem at that moment. A patient comes in with abdominal pain. I make sure that, okay, abdominal pain is done. Okay, so I make sure that there is no big, cancer, everything is okay. But if I spend some time evaluating, how is your sleep? What are you eating? The model doesn't allow me to do that in detail. So in US, there is this new thing that is coming up. It's called lifestyle medicine, where they evaluate the patient as a whole and then go deep into it and then understand that not one size fits all. And I'm so glad that you guys, Apollo, is coming up with similar concept called ProHealth. And you are trying to do the same concept with our audience. And I'm very excited about it. And can you tell us what does this ProHealth means?
So, like you mentioned, we are a product of our genetics as well as the lifestyle choices we are making. What I mean by that is the food we eat, in what quantities and what is on our plate, what we consume, how much we move physically, and how well we move, sleep, how well we sleep, how much time we give it, and what is the sleep pattern itself, how much stress is in our lives, and how that impacts our way of functioning and all of the other body systems. And finally, the consumption of sometimes harmful substances in quantities that are far above
correct
what is suggested and recommended. And therefore, as a combination, these lifestyle choices that each of us is making has actually also, along with the genetics, is now impacting us in India much more than ever. In 1990, only 25% of the deaths in the country were due to non-communicable diseases. The common name for that is lifestyle diseases. These are things like diabetes, cardiac issues, cancers, asthma, and so forth, right? Recently, we also have mental health added to this list.
Big time.
And therefore, these lifestyle diseases today in 2019 in India, 65% of the deaths, up from 25% in 1990. Right?
The last 20 years.
That's right.
20.
That's right. And I actually think with the boon that liberalization brought us as a country, we now have access to much more as a country, and therefore our food has now ranged from what is traditional to much more pizzas, fast food, on the go, whenever we can. Our lifestyle is sedentary, ACPC jobs, much more time spent in front of computers, right? Versus think about pre-90s. And the stress, the sandwich generation between 40, right, about mid-30s, let's say 35 to 55. I call them the sandwich generation because they actually have children to care for, and now aging parents who are living well beyond, right? The average age nowadays is about 70. And therefore, their ailments and taking care of all of them along with professional growth, right, is now a sandwich generation that is not able to make themselves a priority.
Correct.
And hence, in this context, we need more and more people to make their health a priority much earlier so that they are not ending up in the ICU.
Correct.
Right? Or in your office.
Correct.
With an acute situation, right? Health situation that needs treatment. That's what we want with ProHealth. Be proactive about your health and actually be mindful about some of the impact that the lifestyle choices you're making have on your health. And then start taking steps towards being much more healthier, much earlier in life.
Correct. So the proactive choices that you talked about is not usually done over here in India. Okay, the reason is that because I've seen patients over here, I've seen patients in US as well. In US, it comes as a part of the package where you go and see a physical exam with a doctor. And then, the doctor says, okay, did you check your cholesterol levels? Did you get a colonoscopy and everything? Here, the mindset is, I am doing well now. Why should I go to a doctor? Why should I get a screening done? And as a medical professional, I know that screening is absolutely important at any age. That's why we have age-specific screenings. How do you convince a patient over here to say that, hey, this is important for you? What do you practice?
Yeah. I think the biggest difference between the US market and the Indian market is that insurance is much more evolved and mature in the US market. And therefore, they actually have been driving the consumer's behavior to be able to be more proactive about their screenings and get them to do so much earlier. In India, this choice today largely still lies with the individual. The challenge has been the mindset of people. And I encounter multiple different types. The first one is what you described. I'm doing fine. Why do I need it?
Exactly.
Well, preventive health is actually about tackling the intangible. You do not realize what's happening inside your body until it manifests as what we call a symptom. And at that point, the body has essentially said, I give up. I have tried compensating for all your choices. And I've worked very hard at it. I now give up. That is what a symptom is. If we wait till that symptom happens, we are basically now only left with treatment. Right? We have to actually be mindful of that intangibility, as hard as it is, much earlier. And there are ways that we, can do it very simply. Let's talk about, the amount of fat around your belly, right? The waist to hip ratio is one of the biggest things that you yourself can do.
Correct.
Right? An inch tape at home, it's a very common right, item you can use. Measure your waist, measure your hip, and if that ratio is greater than about 0.95 for men or greater than 0.8 for women, then let's just say that that's a problem to tackle.
Just for my audience, usually I talk about the waist circumference
Yes.
and inch tape around the belly button.
Yes.
But there is another marker which is also equally or even slightly better specificity in terms of your metabolic risk, which is waist to hip ratio.
Yes.
For our audience, please explain, how do you measure the waist with an inch tape?
Yes.
What is this waist to hip ratio in terms of numerator denominator?
Sounds good. So the waist is essentially, you take your belly button and you actually measure around it. Yeah. The hip is actually the widest portion, what we all know commonly as the buttocks.
Buttocks, correct.
Right? And take an inch tape around that.
Correct.
And measure. The waist is the numerator. The buttocks, widest part is the denominator. And that ratio, right, it needs to be greater than 0.95 for men and less than 0.95 for men and less than 0.8 for women.
So let us take an example.
Yes.
So if you take hip, usually if the belly is big, the number should be around like 9500. Okay.
Yes.
And then hip is usually around like 90, 95. So 100 by 95 would be like 1.05, something like that. So which is more than 0.95 in male. So which means there is some kind of
something going on in your abdominal area and metabolic health. Enough of a visual marker already, right, for us, and simple tool at home. And that alone should get you off your seat and go get a screening, because that's what will tell you what are the top 2 or 3 problems for you to tackle first.
Correct.
So the first part, like I said, it's the intangibility, but what's going on inside, we actually do know at some level. The second piece is around some people who say, I'm fit. I'm physically extremely fit. I run marathons. I go to the gym every day, right? So I must be healthy. Well, in those cases, let me give you an example. You are working your heart much, much, much more than the average person. When was the last time you tested whether your heart's pumping capacity and electrical impulses are actually okay? Because when you're working your cardiac heart muscles so much, you have to make sure that they're okay and they can keep up with your ambitions and aspirations for fitness. So let's make sure that even if you think you're extremely fit, you may or may not be healthy. And they are very different things. Another example could be cancers. They don't necessarily correlate with people who run marathons, right? Or go to the gym.
Correct. The risk is lower,
yes,
but at the same time, you are not completely free of it.
That's right.
So that's why we do screening for everybody.
Everybody. Right? And we'll focus on different things based on what your needs are, based on what your family history or genetics are, and your choices are.
So one thing I really like about what you explained to me was, so you see patients as a whole, and then identify the risk factors for the particular patient.
That's right.
So that's what we do as a gastroenterologist in US, where we risk stratify for colon cancer. And I'm glad that you have included that in the profile. I just wanted to explain a little bit about colon cancer to my audience. So we do colonoscopies on a daily basis. So we do close to 20 colonoscopies per day. And people should understand that in US, it comes as a part of the insurance package, where insurance says, okay, when you turn 50 or 45 based on insurance, we will cover you and you get this done. And you will not be, you'll be surprised that 1 in 4 of the people that I scope, I see pre-cancerous growth inside the colon. What does mean by that is, if I leave that alone, there's a 25% chance that it can grow into cancer in 10 years. So if I go in and then I remove the polyp, the risk is completely gone. Okay. And is colonoscopy the only way to detect? No. There are other options as well. One thing I really like about your profile is you also offer stool testing, correct?
Yes.
And also virtual colonography.
Yes.
Can you explain to my audience? I think this is something new that I wanted to tap into.
Yes. So colon cancers is actually one of the top 5 cancers in India. And A colonoscopy allows us to actually go in via the rectum and be able to see what's going on in the colon, which is the bottom part of your digestive tract. What happens is that we tend to do less of it again because the choice of doing it is in the hands of the individual, the consumer. And it's obviously a little bit of a discomfort.
Of course.
Yeah. We don't like to do something that's uncomfortable unless we absolutely have to. Therefore, fewer people choose to, even if it's part of the package. They say, no, I don't really want to do this because it's uncomfortable. Do I really need it? Now, remember what I just said. If it's progressed to a symptom, so you see blood in the stools, right? Or you have extreme gastric issues of some sort. Remember, by then we are seeing symptoms. And it may be a tad too late. Our goal is to actually do this much earlier. And that means you may have to subject yourself to a very short period of discomfort in order to pick things up early and be able to be free of some of the problems that can arise later, which is cancers.
Correct.
The same is also true of pap smears and mammograms for women. Uncomfortable procedures. I'm sure all the men and women will agree with me that colonoscopies, pap smears, mammograms are things we want to avoid, but that's not a good enough reason. Put up with the 10 seconds, 30 seconds, 5 minutes, whatever it is.
For your long-term.
For your long-term health. It is important and it will save all of us, especially your families, the trouble of finding out these things much later, right? And needing to then go through extensive treatments.
Correct. So regarding colonoscopy itself, there is no clear-cut guidelines for Indian audience.
Yes.
As similar to US patient population. So in my experience, what I've seen is if they fit into the metabolic syndrome, where they have diabetes, obesity, or the waist to hip ratio that we talked about, the risk is slightly higher, especially if you have family history.
Yes.
In our Indian audience, we don't know about family history that much at all.
Yes.
Either they don't reveal it, or the cause of death is usually unknown.
Yes.
And then the third one is smoking, alcohol, and of course, your dietary habit, lack of fiber, lack of physical activity, same thing. So what I tell my Indian patients is that, hey, if you meet any of these criteria, if you're really scared to do a colonoscopy, at least do a stool testing, or virtual colonography, like what you're offering. Maybe around the age of between 50 to 60, and then start getting things done. And which is one thing that I really like about this ProHealth thing. The second thing I want to talk about is the pap smear.
Yes. People don't know what pap smear is, so can you explain to the audience what pap smear means? Sure. For women, the cervix, which essentially you would go through your vagina, is a canal, and the chance of a cervical cancer, again, is very high amongst women. It is one of, again, the top 5 cancers in the country. A pap smear essentially will go in and take a sample of the cells in the cervix, and through a microscope, a pathologist will evaluate whether those cells are normal or not normal. And then there might be, depending on what we find, subsequent treatments and so forth. Therefore, it is an uncomfortable procedure, and one that many women I know, right, would actually rather not do. However, it is like I said, one of the top 5 cancers in the country, and very important for us to do. We are grateful for a vaccine for cervical cancer called the HPV vaccine that has come out, I think, about 15 years ago or so. It's just picking up in India, where pediatricians are now actually offering it for girl children from 10 years onwards. And you can take it between 10 and 25, ideally earlier. From 11 to 12. 11 to 12 or so. And you have about 2 doses. And this prevents you from getting cervical cancer.
Correct.
That said, many women of my generation, right, will need to continue to do pap smears. The good part is you can stop after 65. So what we talked about, every decade brings different milestones, right, in terms of our health. And therefore, we have to be mindful about what this decade, right, is here for us, what, therefore, we should be tested for. And those are the aspects we take into account in ProHealth. We actually bring in age, we bring in gender, we bring in family history, we bring in lifestyle choices. And then we say, based on all of this, what do you need, right? And what should you be tested for? And let's make sure we actually get that taken care of. You brought up another point earlier, Dr. Pal, which is around family history and how we don't know as much about it in India. I think that, we didn't worry as much about the cause of death before. And people, lived a good, happy life. And if they got any of the conditions late, we actually, talked about it as stomach pain or dementia.
Exactly.
We really didn't go down to the level of diagnosis and treatment as much as is today.
So we accepted the cause of death as a part of aging.
Exactly. And I think that is who we are culturally, right? And we didn't ask too many questions around the exact nature. Therefore, if you ask our parents' generation how their parents passed away, they may not actually know the exact cause of death. I still remember having this conversation with my father, who had a shoulder issue, right? That turns out to be genetic. And when he found out about it, he said, oh yes, now I remember that my father struggled to put on, his t-shirt, right? Struggled to raise his arms above his head. But we never diagnosed those with MRIs and understood what was happening to the shoulder and the muscles. And therefore, I think that this generation has changed. We are now beginning to understand what some of the causes of death are and the chronic conditions that our parents have. Therefore, the generation of people in the 40s and the 50s now have a better understanding. And this is a wake-up call for those in their 20s and their 30s, because they actually do know.
Correct.
Right? Correct. So if you have diabetes, hypertension, cancers, sudden cardiac deaths in the family, please take this seriously. This is actually increases your risk of many of these conditions multifold over somebody who doesn't.
There's a small thing is even family history of diabetes.
Yes.
Puts you at an increased risk of diabetes.
Yes.
If you are not, metabolically active.
That's correct.
So I've seen many of my colleagues and my friends who being a diabetic is extremely common these days in the parent population. The concept of the increased risk has not imbibed or ingrained in subconscious mind, where the lifestyle choices continue to be poor.
Yes.
So I think the awareness that, okay, so I'm at an increased risk to start with, and then I want to make sure that everything is okay from my end, to make sure that what I can control from a personal aspect.
Yes.
So you talked about the decade specific screening, correct? So let's start from there. So let's start from 10 to 20. Okay, 10 to 20, men and women, boys and girls. So we talked about HPV vaccine for girls around 10, 11, 12. And then for boys, probably not that much.
Not that much. I think they have growth spurts. And as a result of sometimes, growth spurts, there might be associated concerns around, fainting, dizziness, hormones. Some of those things start to come into play, right? And important for us to take cognizance of what may be going on and be supportive through that. I think if we come back to girls a little bit, hormones are a very important part of a number of chronic conditions later, right? We don't think about hormones as much. Yes, excess carbs is a factor, but hormonal imbalance actually puts women at risk, at a very different level of risk. And that starts in this puberty age, right? And therefore, there might be concerns around the regularity of menstruation, when it starts, And therefore making sure that hormones, iron levels, all of this is actually taken care of for women and girls in sort of this 10 to about 14 age group. Another area, and this is across boys and girls, is stress and mental health. We are not thinking about it as often. We are in a very different world now than when I grew up.
I know.
Yeah, didn't have access to devices and social media and cyberbullying, and
you didn't have Instagram social handle?
I didn't have. And let me tell you the
Dr. Sathya official. There's a 2 handles, official and personal.
And the personal, right? And the kinds of impact that has on your cognitive state, right? Moving from reel to reel to reel to reel, attention spans. We are now setting the tone, right, for shorter attention spans, which translates into the classroom as well. We, are the amount of cyberbullying, or even in the classroom, because of the exposure, the bullying that happens is almost subliminal at some point, and we don't even realize that it's happening and the impact it's happening on the child. And therefore, all of that stress, along with, of course, the academic stress, right? We are a privileged class of people that want more education and academic achievement for our children, because as a country, we know that sets you up and your family for a very different economic path, right? And that adds more stress and success. All of this ends up being mental health disorders that are increasing among children. And it's not easy to talk to your parents about it.
So what do? You talk to your kids, the kids separately?
We try, right? We try and talk to our kids separately. And the only way to do it is to not sit them down and have a lecture. We have to actually be part of their lives, understand what their school day was like, talk about their friends, talk about what's happening with their friends, right? And other students in the class. Ask probing questions from the point of view of simply understanding what their day is and start picking up some of the issues. If the same friends' names are not getting repeated, right? Should that raise a red flag or not? If they talk about someone else, feeling sorry for them, right? Understand if something like that has happened to them. And also share your day. That's a great way to get kids to open up. Let's be vulnerable with our kids, right? I don't remember my father sharing his day with me, right? But I think that in today's day and age, to be able to have a conversation and share your stressors with your children allows them to then feel like they can also open up with you. And if it's not possible, right, and you're still hitting a wall, enlist the help of the school teachers. Enlist the help of a pediatrician. I find that my pediatrician is able to get through to my daughter far easier than I can. And I think that having them actually have a conversation with your child when you're not in the room is usually a good way to break the ice and get them to, open up and share. We've actually created a ProHealth for children based on these issues between 10 and 16, right? And added in these elements only if you need them, right? We have to be careful about also over-testing, right? So simply putting an ADHD questionnaire in front of you is not going to cut it. You only if you pick up signs of it, right? And you suspect that there might be aspects to actually test, then include it, right? Let's talk about another area for this age group, dental and eyesight, right? Eyesight much earlier also. Even as a 5-year-old, you should be testing for it and picking up simply what's going on.
Why is pediatric dental is not being considered screening at all here? And it is a completely different picture in US.
That's right.
It's a completely different picture.
Again,
US is not being covered by insurance.
It's not being covered by insurance.
And we pay.
Yes. And I think it's the awareness, right, around that. We are now beginning to see an increased number of dentists and increased awareness around dental issues. But we don't take it as seriously, and we don't think about it as screening. Oral hygiene contributes enormously is connected to your gut, gut connected to your cognition, right? All of our body systems are actually interconnected like this, and very important to take care of some of these issues early. We know the answer. You have to do the screening every 6 months, all right? And if your schedule doesn't allow it, at least once a year. Please make that a priority, right? And we know that excessive sweets and not cleansing after meals.
I mean, 2 times brushing, flossing is something that I have never heard myself.
Yes.
Okay, I was so surprised that people were flossing. I mean, dentists were asking me flossing. I said, I've never flossed ever in my life. After 20 years.
That's right.
Then I was realizing, it would have been a different thing if somebody has told me, can you floss when you are around like 10 years of age?
And then it becomes a habit.
It becomes a habit.
Right? The problem for us right now as middle-aged adults is to start a new habit. Habits form early. We do not think at all about getting up in the morning and brushing. It is such a part of your lifestyle that your brain doesn't even have to think, right? You just get up, you walk straight into the bathroom, you pick up the toothbrush and you go. That's how we have to make screening as well. I love people who actually make it around milestones so they don't forget. How do you make things a habit? You need a cue of some sort, right? And that cue could be a milestone in your life, a birthday. My parents for years have been doing their annual screenings with coinciding with the week of their anniversary, right? They do this together. You won't forget it, right? And so finding a ways to make these things a habit is always a challenge. Starting early, therefore, is very important.
So maybe a birthday of a child.
That's right.
Might be you have your birthday treat, cake, and then let's go to dentist.
That's right. That's right. I mean, make it about a birth month, birth week.
Correct.
We're all having multiple professional careers, lots of, time constraints. So expand it, make it easy on yourself, right? Make it the week of the birthday, make it the month of the birthday. That then allows us a little bit room as well, right? To make sure we're not hard on ourselves.
Yeah. So, but at least the concept of, a regular checking. Okay, I completely agree with you. Pediatric dental is one of the main things.
That's right.
So, moving on to the next decade, 20 to 30.
That's right.
20 to 30 is where...
Golden years.
Your mutual fund investment is right there.
Right.
It's right there. So,
independent from your parents, first jobs, lots of freedom.
Maybe some new money that is coming into your life. Financially, you're getting secured.
That's right.
And a lot of things that you can do.
That's right.
And I think if you can fine tune in a good way,
I
think that'll be a wonderful platform, bottom line foundation. So usually around 25 years of age is where we recommend to check your lipid profile.
Yes.
And then every 5 years.
Every 5
after that,
years.
and if it is abnormal, sooner.
And if you have risk factors.
And if risk factors.
Right? If you know that your parents actually have high cholesterol.
Or diabetes.
Correct. Right?
Heart disease.
Or heart disease.
Yeah.
Please make sure that it's annual. You have to get that annual because sometimes these things creep up on you. The problem is we actually go with a single value and that blood report says it's a red or a yellow or a green. Now, if it's a single value and it's a green, you may be on the border. You don't realize how you may actually very quickly progress to the orange. And before you know it, on the borderline between orange and red. What we tend to actually miss is those who are moderates. Right? On the cusp of
high normal.
High normals.
High normal. Yeah. Right? I've seen this before.
And therefore, be careful about just obsessing over a single number and a green dot against that report. Right?
So, for example, LDL is a wonderful value that we can take as an example.
Yes.
Okay. So, LDL, they say initially 130 and then it should be less than 130. Then it's less than 100. They say less than 70 for high risk people. So, when I checked my LDL initially, it was like 129.
Yeah.
And it was normal.
That's exactly what I'm, right? Talking about it's normal, it's green. And that's what most test reports will say.
Correct.
Right? And then you say, oh, yay, I'm green. I put it away in a drawer, forget about it. And suddenly 5 years later or 10 years later.
It just creeps up.
It creeps up. Let's come back to the year of the 20s. Right? I think another thing at that time that we lose sight of is again, sometimes for women, especially thyroid, right? Increasingly, we're seeing PCOS or polycystic ovary syndrome creeping up on women, again related to hormones and weight. And that then causes fertility issues as you progress towards the late 20s and early 30s. So that's another thing for us to keep in mind as well in the 20s. 20s again is a time with first job, newfound freedom, some money. Therefore, people tend to experiment with alcohol, with smoking, with drugs. Be very mindful about the amounts of some of these things and the impact it's having on you. Another thing that we do a lot of during that age, depending on the job, is sitting.
Right? A big time. So they say lack of physical activity is almost equal to smoking.
Exactly. 15 cigarettes a day. Right? That's something now let's not worry about whether it's 15 or 20 or 10. The bottom line is sitting is bad for you. Why? Sitting for prolonged periods without moving essentially drops your basal metabolic rate. And that means the metabolism that's going on inside your body at a resting state. That means you're not running, you're not brisk walking, right? At a resting state, body is still breaking down the carbohydrates and generating glucose. It's doing something inside, even when you and I are just sitting here on the couch and talking. That's called the basal metabolic rate. That basal metabolic rate tends to drop when you are not moving actively. And 30 minutes, 45 minutes of sitting, right, drops it down to as if you were sleeping. Right? So what do? Break up your seating time. 30 minutes, 45 minutes, right? Every hour, make sure you move. Take a few steps. I'm so glad that there are now a movement towards having coffee machines and water coolers in common places. That means your coffee doesn't come to your desk. You get up, take the 100 steps required, right, back and forth to go get that cup of coffee, right, to go fill that water bottle or your glass. If you're sitting in a long meeting, it's okay to stand up, right, for a few minutes and then sit back down. Move your feet, right, almost up and down, right, at the ankle, under the table. Nobody will notice. But remember, you're doing something, right? And this then allows you to keep your basal metabolic rate at a higher level than if you were simply sitting.
Right. And also there's something called soleus push-ups where we do this and lifting the heel up and down.
Yes.
I put a reel on that as well, that is considered to be a little bit more metabolically active.
That's right.
So physical activity has to be incorporated in that age.
Absolutely, because the minute you start to do it at that age, you start to make it a habit, right? You have standing meetings, right?
And then you have standing desk now.
Standing desks.
That's
standing
wonderful.
Meetings. If you need to meet
not taking elevator.
That's right. Oh, that's a big one.
Not taking lift.
That's a big one. At least my own personal rule is 5 floors.
5 floors.
Right? Anything less than 5 floors, walk it. Right?
Depending upon the steps. No.
5 floors, right?
5 floors.
If try for yourself, right? Because every one of us is different, right?
Correct.
So try for yourself. My rule for myself is 5 floors.
That's a good rule. Okay.
If I have to get to the 5th floor, right, I will walk it. Now, any greater than that, I'm living on the 14th floor.
Absolutely elevator.
We understand.
Yes.
We understand that you need to take the elevator.
Correct.
Absolutely.
Just a thought process.
Yes.
Just a mindset.
Exactly. And we're able-bodied at that age. Let's save the elevator for those who have arthritis.
Correct.
Right? For those who can't do
the things that we can do.
That's right. Right?
And also parking your car way away from the restaurant.
That's right.
Something that, even though we eat a lot.
It's good for actually afterwards.
Correct.
Right?
Afterwards as well.
Afterwards, because, you eat a nice hearty meal and then you have to have some steps before you actually sit back in the car and drive the 45 minutes home.
Correct.
Yes. So it's okay to actually have the car parked far away. Take the keys from the valet, tip them right there for having parked your car earlier, and walk to your car. Right? So these are small things that we can actually start to do early. And if you are lucky enough and now are living in a large Indian city with the metro, and some public transportation, please do find a way to take it. There are days when I don't get the car in time for my pickup. I don't think twice about walking to the metro, taking the metro home, and walking the, 300 meters from the metro station to my home, right? Thankfully, India is catching up on that front. And if you're living in some of the bigger cities, you have this as an option.
Yes.
Please find a way to take it. That way you take cars off of the road and you're contributing to sustainability and to climate change.
Traffic as well.
And traffic as well.
So, ma'am, we are going to the next decade.
Yes.
So, 30 to 40.
Yes.
So, that's a time that you have like maybe 1 or 2 kids and you're extremely busy. And if you're in US and that's it, people think it's a luxurious lifestyle. Absolutely not. Absolutely
yes. Not. Privileged in different ways.
So, what is your take on them?
Yeah.
How should they look at it?
Yeah, 30s are just everyone's very short on time. Lots of stress.
Busy.
Very busy. So just do the easy way out. Screen annually. It is just a couple of hours, right? Once a year for risk factors.
Doctor.
Yeah?
Go to the doctor.
Go to the doctor. Please don't do just a blood test at home and be done with it, because many things come up, right? Only in the imaging scan. So do a proper, right, health check, evaluation. Spend that time, but it's only a couple of hours once a year. You could easily take that time. So make screening the priority in your 30s.
So in US, there is this, we go to a primary care physician.
Yes.
Okay. So in India, so if let's say they're health conscious, nothing is happening with their body.
Yes.
They go to a doctor. Correct?
That's right. Go to the doctor. Go to, even if it's a diagnostic facility, make sure you take something that's comprehensive, right? In terms of your health check. Do not do sort of only blood tests. They only tell you part of the story. Right? You will not be able to get the full picture. So do a complete evaluation and make sure a doctor is evaluating the report. That is very important. Don't simply just say, a set of blood tests enough, I get the report, I make the interpretation myself. Or I will Google anything that is right, that is read.
Right.
Because something as simple as, let's say, an ESR, an erythrocyte sedimentation rate, right? It's actually a very general inflammation marker. That means an inflammation is happening somewhere in your body. So a high ESR, a red in that blood test, could mean many things. When you put that ESR in the context of another test, either a blood test or imaging, or more importantly, when a doctor speaks to you and understands you have joint pain, right, or any of those additional symptoms, then you start to make the correlation and connection between what that ESR could actually be representing, right? So just simply by itself, it is quite meaningless. And that's why it's very important to have a doctor review. And in ProHealth, we make sure that every report is evaluated by an internal medicine or general medicine doctor, right? So we're talking about the 30s and 40s, very difficult time. Therefore, just do the health check, proper, complete evaluation, and move on. Hopefully, everything's on track. If it's not, you know what to fix.
And then 40 to 50 is where I strongly believe that this has to change.
Yes.
In Indian society, this has to change, where breast cancer screening is a area that is very, very underutilized here. Yeah. And not only in India, this is the exact same thing in Indian women in US as well.
Yes.
Because we think that nothing will happen to us, number one. Number two is, this is something only for people who have some kind of problems.
Yes.
And a simple mammogram, okay, where is an X-ray of your breast.
Yes.
Will pick up so many abnormal lesions if you have.
Yes.
And it can be easily prevented before proceeding with to breast cancer. So I want to know the prevalence and estimation, some data about what is happening in India and for our community, and then what is your practice that you're seeing in the hospital, and what is about the mammogram picture.
Breast cancer, unfortunately, is the #1 cancer for women in India. And our work at Apollo Hospitals, looking at mammograms and following people right, to malignant breast cancers, we find that the average age of diagnosis of breast cancer is actually 54 to 55 in Indian women. In Caucasian women, in Western populations, that's actually in the 60s, right? So for some reason, right, genetics, environment, a number of combinations, we actually, in Indian women, have the risk of breast cancer much earlier. Therefore, we have to screen earlier. Mammograms are the best way, gold standard in identifying breast cancer early. It's also uncomfortable. 99% of women I speak with say the first thing, oh my goodness, a mammogram. No, I don't want to do this because it's so painful. It's painful for less than 10 seconds on each side.
It's an X-ray, just an X-ray machine, correct?
It's an X-ray machine. It takes images of what's happening inside your breast. So you need to do the right and the left. And because of the nature of how the machines are built, you have to squeeze the breast. And that causes the discomfort.
I see.
Right?
I see.
But only if you do that are you able to see the different slices and be able to see clearly what's going on. It is uncomfortable. But let's just do it. And if you have a family history, especially on the maternal side, right? So a mother, aunt, grandmother, all on the maternal side, then your risk of breast cancer is much higher. So if you have family history, start in your mid-30s, right? If you don't have family history, it's okay to start in your early 40s. Make sure you do it at least every 2 years. If you have family history, annually from 35.
And also the same thing we talked about, metabolic syndrome, obesity, again, that increases the risk as well.
Absolutely. So family history is one, metabolic conditions, disorders of all kinds, right? Increases the risk as well. And as a result, this is something that and it's also, it's uncomfortable, but it's also something that we don't talk about.
We don't talk about it.
Yeah. We're embarrassed.
Correct. It's similar to a gastroenterology. We don't talk about constipation. We don't talk about anorectal disorders, hemorrhoids, blood and stool. People don't come out because they think that, okay, it'll go away on its own.
That's right. A gas, something gas, right? Simple as that. We don't talk about it. It's embarrassing.
Embarrassing.
Right? We don't talk about the breast. It's embarrassing. Right? And therefore, we don't have these conversations. We don't share. We don't do a self-exam. Right? We don't do a self-exam. So yes, you could do a mammo once a year.
Can you talk about self-exam that you can examine your breast by yourself?
That's right.
And looking for any nodules.
Yes. And it's actually, you actually touch, palpitate, massage, feel. And when you do it on a regular basis, right? When you do it on a regular basis, then you'll pick up the change. It's very hard. Suddenly one day you decide and you see, and then you don't know, right? It's about the change over time, right? That's the part that you have to become aware of. Oh, wait, this wasn't there when I felt it a month ago. Let me see what happens in the next month. And a good way, again, because it's a habit and you're not going to stand there and think, I should do it today, right? Good way to do it is right after your monthly cycle, right? Right after your monthly cycle.
Okay.
Good time
to remember,
right? Let's just do it and take care of ourselves. And if there's any changes, any discolorations, right?
So look at it as well.
Look at it.
Look at it, any discoloration.
Discoloration.
Any previously soft area, now nodular.
Nodular. So that means harder.
Harder,
right? Feeling of some pain. So when you press, there's right, sharp pain or discharges from your nipple, right? All of these are signs, right? And therefore, watch for some of these things as well, along with, of course, the mammography, which gives you a much better sense as part of screening, even when the symptoms are not there, right?
Correct. And why should we do this? So that we
catch it early.
Catch it early. And if there is some kind of, let's say, nodule, okay, so we usually biopsy that.
Biopsy it. And the biopsy what will tell us if whether it is benign or cancerous, malignant.
Or precancerous.
Correct. Right? And then what stage and then working with, if required, an oncologist to figure out a treatment.
Correct. Usually what I've seen is when you screen like 40 to 45, I've seen so many of my friends where they are diagnosed with stage 1,
That's right.
1A.
Much easier
to
treat.
And just they remove it.
Yes, mastectomy,
That's it.
right? Or the nodules, lumpectomy. Right? And that's, you're done. You move on. And you live a perfectly normal life.
Correct.
Problem with not doing it and catching it later, right? In your late 50s, 60s, right? At that point, you're much, stage 3, 4. It may have spread.
I'll tell you an example of a patient that I saw. 60-year-old, 55-year-old comes in with jaundice.
Yes.
Okay, so jaundice is something that liver is not working.
Yes.
So when a liver is not working, we do an ultrasound. In ultrasound, all we see was cancer deposits in the liver. We asked about smoking, alcohol, nothing. Okay. Then she had some kind of breast issues for going on for a long time. So then we biopsied the liver. It turns out that it is a breast cancer spread to the liver. Okay, and this was around 50, 56. And then the lifespan is very minimal.
That's right.
Stage 4, it's only like 6 months to 1 year on the best case scenario. So looking at the one thing I will never forget that lady said me was, I wish somebody has told me that to get a mammogram between 40 to 45. And from that moment, I was like, why are we not doing this? So I tell in my channel, I say, every man should make sure their mom, their wife, their daughter, their sisters should definitely get a mammogram.
Yes.
Push them to get a mammogram between 40 to 45.
Absolutely. No, this is the number one message for women out there. Please get the mammograms.
So tell me about men between 40 to 50.
So men and women alike, I think another area to watch out for is lung cancers. We're seeing that again because of smoking, genetics, and increasingly pollution, right? Although not proven, increasingly pollution.
Pollution, I think it's going to be number one moving forward soon.
Right. That's right. We're finding that there is a much higher risk and diagnosis of lung cancers that can be picked up with X-rays and depending on the facility, even a low-dose CT. This is important to do. We are living in large urban areas. Pollution, passive smoking, even if you are not a smoker, is on the rise. And if you are a smoker, then please, by all means, this is important to get done. Picking up lung cancers, nodules much earlier, very important. Again, similar to the breast cancer, treatment is very much possible earlier, much later, right?
Are you seeing lung cancer in females?
Yeah, we are. And we're seeing it amongst smokers, but also among passive smokers, but also amongst people who are not even exposed to smoking in their household, right? And this is where we start to wonder what's going on with family history of cancers, right? Contributing, potentially pollution. And so some of these things are not easily explainable as to the direct cause. We need to just do the X-ray and pick it up early.
So moving on to the next decade, 60 to 70, and I strongly believe that women in this age to be screened a lot more for this condition called osteoporosis.
Yes.
I spoke to an orthosurgeon before. He told me that the increased risk of joint replacements, knee replacements, hip replacements are happening more in females compared to males. And the key thing is because their bone health is not the same.
Yes.
Multiple reasons because of hormonal imbalance and everything. But the main thing is that lack of strength training, no muscles around the knees, number one. And then obviously the obesity kicks in towards the end of the menopausal period and during the reproductive period as well. So I want you to teach our audience, okay, how do we diagnose osteoporosis with this? We usually use DEXA scan.
Yes.
And how do you use that in your population? And then when should we screen and at what age?
Sounds good. So again, in the 60s, we're talking about the 60s, the bone health becomes a very important part of the consideration. And here a DEXA scan, essentially think about it as a way to see, right? Almost like an X-ray of your full body. And of the bones and what's happening between the bones and the muscles and what's going on. That then allows us to determine conditions like arthritis, osteoporosis, as well as uh, any areas of lower muscular, right, concerns, which will lead to falls, right? And falls are our biggest problem, right? And
Fall means they slip and they
slip
fall
and
down
fall,
and they
right?
fracture.
And they fracture, and then suddenly movement is restricted and life changes.
Yes, exactly.
So all of this, remember, we're doing to keep in mind the fall risk, right? So bone health is a concern, and you don't want to fall, right? Because if you fall, then a whole bunch of your life and your life's
Span also decreases eventually.
Sorry, what I'm going to call health span, right?
Span.
Your quality of life suddenly decreases.
Correct.
So the DEXA scan is important to do to be able to determine, right, what your bone health is like. For women, for sure, for the reasons you raised, we don't do as much flexibility and strength training early in life. So when we think about physical activity, right, we think that just simply doing much more household chores, right, is sufficient. But actually, flexibility and strength is correlated with the quality of life much, much more. And you should start that in your 30s and your 40s. The other area is the hormones. Our hormones change completely after menopause, right? This is a way of life, and that is why women bone health is a much bigger consideration than men. Not to say that men, you should not worry about your bone health, you should too. But for women, the changes in the hormones, right, result in many changes, right, and therefore causing suddenly a difference in what's going on inside your body, and therefore bone health becomes a concern. So we should take care and make sure that any hormonal issues that come up, we watch for. If you have early menopause, that means menopause in your late 30s, right, early to late 30s, then you must actually start your DEXA not in your 60s, but actually in your 50s, right? Because remember, because of those hormonal changes and issues earlier in life, it's impacting your bone health. And the way to screen for bone health is DEXA, right? And therefore, you have to actually make sure if you have no issues, no symptoms, no family history, 60 is an okay place to start. But if you do, then you should start earlier.
So when I talked to an OB/GYN doctor, so she was saying that early menopause is happening more frequently. So what happens in that period is that your hormones changes, where you don't have the bone preserving hormone that much.
That's right.
So when you have early menopause, we recommend calcium and vitamin D supplements and a lot more as well. So there is something called this FRAX score that you briefly touched upon.
So in ProHealth, one of the things that we've done is we've taken into account this age group, right? And we said, listen, what is important for people who are above 60? Bone health becomes very important. And FRAX score, which is the fracture risk score, right? We are now using this to determine your risk of fracture. As a result of which, again, we come back to, if you fall, your FRAX score is high, so your fracture risk is high. Then we want you to be more careful, and we can advise you accordingly, right?
So when the FRAX score is high, the risk of fracture is high.
That's right. So you want to take supplements, calcium, right? Important multivitamins and so forth, so that you're able to preserve the bone density. We also recommend that for women, even if you're starting at that age group, simple things like, add a kilo weight and lift it, right? As a way to strengthen muscles, or around your foot, right? Tie a water bottle that's full of water, right? This anybody can do. And then lift your feet at the knee joints, right? Then this will strengthen those muscles. Start to do this as part of your routine. You have time in your 60s, hopefully, to be able to do these kinds of things in addition to the regular screening.
So in this 60, 70 years of age, this is where we have been seeing, dementia, Alzheimer's, and it's one of the form of dementia. Usually it's supposed to be a very elderly population problem, but now it's much younger. Any thoughts on that, and how do we screen for that?
So we usually think about dementia in people post 75, 80, right? We are living much longer. Average lifespan is now 70. But what we are also seeing is that because of mental health stress, as well as some of the other metabolic disorders like diabetes, cardiac conditions, that's having an impact on your cognitive abilities. What I mean by that simply is actually your brain function. Your brain function. For example, brain function is a function of how quickly your nerves in different parts of the body relay impulses, how you are able to store memory for short periods of time and long periods of time. All of this is what we call brain function cognitive. We're finding that with these metabolic disorders, working memory, that means short term, your ability to actually remember the 5 things you need to do today, right, starts to fade a little bit. And so we've introduced cognitive screening, right? A simple game, right? 15-20 minutes on your phone. That is part of our program that will then allow you to say what's going on with your brain function. We can then, again, none of this works in isolation, Dr. Pal. We have to put it in the context of everything else that we find as well, right? So if working memory is on the lower end, less than average, or what we expect at that age, or memory functions, right? We're then able to say, okay, what else could be going on here? How do we then give you exercises to do to keep you sharp? Remember, in the 60s, a lot of people retire.
Correct.
From keeping themselves professionally very active,
right?
They suddenly go to almost nothing. But there is so much one can do today, thanks to virtual, right, Zoom or non-profit work, playing with your children's children, grandchildren. So volunteering, mentoring startups, lots of possible things that you as a person can do to keep yourself mentally active, right? And I would strongly recommend, right, that people find themselves not worrying about all the time that they have, but use it to do active work, right? Keeping your brain functioning. And this is important to do in the 60s and early 60s so that you don't end up with some of the dementia related conditions, right? Until much later, right?
So ma'am, we talked about a lot of preventive screenings, right? So do you think this thing started, awareness about this, after COVID, or was this happening even before COVID? What was your thought process?
I've actually seen a huge shift in mindsets of the average person on what we call the Aam Aadmi, right? After COVID. And I think what, unfortunately, right, the pandemic taught us many lessons. One is that every body is different. Every one of our bodies is different. We talked about age-wise many of these issues, but that doesn't mean that everyone who's 40 will have the same issue. Every person's body is different, again, driven by the lifestyle choices, the genetics, the environmental factors that come into play. The second thing we learned is that when you have what I'm going to call comorbidities, right, or multiple conditions, chronic conditions, stress, diabetes, hypertension, then what happens inside our body is very different, right? So how the COVID-19 virus impacted one person with diabetes versus another person without diabetes was very different.
Correct.
And that was the biggest awareness creation, right? People actually started to take the chronic conditions a little bit more seriously, right? And I think that is what impacted the awareness, and that is why the mindset has shifted. People are much more aware. I think that is not yet translating into as much action as I'd like it to be. But I'm hoping that with time, we will actually get there.
No, absolutely. This is the right time. This is the right time that I always say hospitals should be only for structural problems.
Yes.
Where you fall down, you have a fracture, yes, you go treat it. You have a congenital problem, there you need to fix it, yes, we need to. So that should be your fallback option in case if you get a disease. The first thing is preventing the disease to start with, and that's what I'm absolutely thrilled about your program. And what is the motto of this Be Pro Health, and why are you guys doing this? What is the overall view?
Yeah, so you're absolutely right. Apollo Hospitals, right, thinks about their mission as keeping people healthy, not about doing the knee replacement, not about doing the bypass, right, surgery. And when we think about keeping people healthy, the first step there is prevention. We actually call our preventive health department and our preventive health screenings ProHealth. That means being proactive about your health. Also, pro is always used in a good context, right? When we say pro versus con, right? We want you to be taking decisions in your life that are pro your health. And therefore, we thought the word pro health really summarizes our philosophy around being proactive and being pro in the choices that you're making every single day. Above everything else, Dr. Pal, I think I resonated a lot with your motto around making yourself the priority. Especially a shout out for women.
Yes.
Yes, our nurturing instincts tend to kick in.
Absolutely.
And we tend to deprioritize ourselves. And men with the intention, right, of taking care of your professional and family, tend to deprioritize this. It's because it's intangible. You feel like you have a few more years before you have to take care of it. Please make yourself a priority and be pro health. If you are pro health, then 5 people around you are inspired to be pro health. And that's why we've actually chosen this motto, to be pro health, and you pass this along. And when you are, your community is, and our country is. Be pro health.
Super. Thank you so much, ma'am. Thanks a lot. It was a wonderful conversation with you. And I hope that prevention is the best cure policy. Everybody should adopt it.
Absolutely. Thank you for having me. Really appreciate you taking the message to all of your followers.
Super. Thank you, ma'am. Thanks a lot. I absolutely enjoy the conversation. I'm so glad that I'm involved in these kind of preventive healthcare discussions so that listeners can at least take one point out of this conversation, so that whichever decade that you belong to, please make sure that you have some kind of preventive strategies in your lifestyle. Remember, one belly at a time, it is absolutely important.